Welcome to the first video in the Pioneers of IR video series. In this video, we will briefly explore the life of Dr. Charles Dotter. My name is Sinan Ali Bana. I am a fourth-year medical student at Texas A&M University College of Medicine, and this video is brought to you by the Society of Interventional Radiology Medical Student Council. For more information about SIR, please visit SIRweb.org. Dr. Charles Dotter is regarded as the father of interventional radiology. His contributions revolutionized the way we practice medicine and set the foundation for a new medical specialty. Dr. Dotter believed there was a better way of diagnosing and treating diseases and looked to replace the scalpel with the use of catheters. Years ahead of his time, Charles Dotter remains largely unknown outside of the field of interventional radiology. In this video, we will explore the life of Charles Dotter and his personal contributions that have saved millions of lives around the world. Charles Theodore Dotter was born in Boston on June 14, 1920. From an early age, he displayed an interest in working with tools and dismantling machines. He received his Bachelor of Arts degree from Duke University and attended medical school at Cornell University. Dotter completed his internship at the United States Naval Hospital in New York State and his radiology residency at New York Hospital. At the young age of 30, he became a full-time faculty member at Cornell Medical School. Only 2 years later, he became chairman of the Department of Radiology at the University of Oregon Medical School, currently known as Oregon Health and Sciences University. And he was the youngest person ever to be named chair of a radiology department in an American medical school. Over the course of his life, he published more than 300 manuscripts, produced 2 scientific training films, and 20 scientific exhibits. In the late 1930s, Angiography introduced a revolutionary method of visualizing the chambers of the heart, pulmonary circulation, and the aorta. However, it was severely limited by the imaging modality of the time. Radiographic images had to be taken one at a time due to the fact that the X-ray technician had to manually change the X-ray cassettes for each new image. Thus, there were gaps in imaging between exposures which limited the studies. In 1950, Charles Dotter developed an automatic X-ray roll film magazine, which allowed images to be taken at a rate of 2 per second. This paved the way for real-time fluoroscopy and subsequent developments in interventional radiology. Perhaps Dotter's greatest contribution to radiology was the interventional catheter. Dotter often invented his own interventional tools using unconventional materials, such as guitar strings and speedometer cables. As he imagined more uses for catheters, he needed to make new catheters. In 1963, Charles Dotter met a man named Bill Cook at a radiology conference. Cook had recently started a business in angiographic supplies and was showcasing some of his products. Dotter asked Cook if he could borrow some tubing and a blowtorch to make some catheters. Cook was surprised when, the very next morning, Dotter had created 10 catheters, which he subsequently sold. Since then, the two men collaborated to develop and advance various types of catheters. Dotter's first patient was a stubborn 82-year-old woman named Laura Shaw with severe leg ischemia and gangrene due to short segmental stenosis of the femoral artery. Despite the risks of sepsis and death, she refused to undergo a leg amputation. Dr. Dotter took on the case as an opportunity to test his percutaneous dilation catheter. The procedure was a resounding success, and within minutes, circulation was restored to the patient's leg. Within a week, Mrs. Shaw's pain was gone, and the ulcer had healed. It took some time before interventional radiology became accepted in the medical community. In its infancy, catheter-based procedures were deemed too radical. In fact, Dr. Dotter was frequently dubbed Crazy Charlie. In 1964, a surgeon sent Dotter a patient for an angiogram of the left superficial femoral artery. The surgeon boldly wrote to Dotter to visualize but do not try to fix anything. The diagnostic angiogram showed that both the superficial and deep femoral arteries had areas of stenosis. Dotter dilated the deep femoral artery, but he left the superficial femoral artery alone. Close follow-up of the patient revealed that the open superior femoral arterioplasty procedure had eventually failed, while the balloon dilation of the deep femoral performed by Dr. Dotter remained patent. Eventually, the medical community began to accept interventional procedures. Dr. Dotter hoped his work would eventually lead to better patient care and new ideas. Although his ideas were slow to be adopted, Dr. Dotter knew that some of the greatest breakthroughs in medicine had met fierce resistance at first, but had proven to be worth it. Indeed, one of Dotter's earliest techniques, percutaneous transluminal angioplasty, is still used as a mainstay in medical treatment today. In 1958, Dr. Dotter developed the technique of occlusion aortography, a new method to reliably and safely visualize the coronary vessels. Prior to this, angiocardiographic techniques depended on the injection of a large amount of contrast into a peripheral vein. Not only did this expose the patient to large amounts of contrast, but it also failed to adequately visualize the vessels and identify lesions. Dr. Dotter's method used a double lumen balloon catheter as seen in the above picture. The technique involved advancing the catheter from the radial artery to the aorta and inflating the balloon in order to occlude the aorta. A small amount of contrast would then be injected and a series of X-rays taken. This method produced beautiful images. Later that same year, Dr. Mason Sones accidentally discovered the technique of selective opacification of the coronary vessels. The combined work of Dr. Dotter and Dr. Sones created the foundation for modern angiography and subsequent therapeutic interventions. People who knew Dr. Dotter described him as intelligent, dramatic, and a risk-taker. He was a pilot, painter, and mountaineer. Despite suffering from Hodgkin's lymphoma and several open heart surgeries, he never let his medical problems get in the way of his goals. Oftentimes, he would make dramatic presentations in order to get his point across. For example, during a medicine grand rounds, Dr. Dotter stood in front of an audience with a catheter in his own heart in order to demonstrate that you could get a catheter in the heart and measure the pressure readings in each of the chambers. This was the type of man Dr. Dotter was, and it was his strong personality and drive that led to some of his most consequential discoveries. Today, Dr. Dotter's dream of replacing the scalpel has become a reality as more catheter-based interventions are developed and used to treat patients. Nearly all specialties rely on the interventional radiologist. In the end, Dr. Dotter revolutionized the way we practice medicine and led to improvement in the quality of care of millions of patients around the world. Thank you for watching this video. If you're interested in learning more about interventional radiology, check out our YouTube channel, IR Education, or visit our website at sirweb.org. Thank you, and see you next time.